the topic that's on everybody's minds at the moment, obviously, is the coronavirus. And I'm joined on the phone by the Director of Wellbeing, Public Health and Communities for Essex, Dr Mike Gogarty. Good morning to you.
Good morning.
What's the situation in Essex currently? Is it as bad as everybody feels it's going to be?
So the situation in Essex sort of mirrors what's happening in the rest of the country. I think it will be as bad as I think the Prime Minister and others are saying. It will be the worst public health issue in my lifetime, certainly. It hasn't anything like it yet. It really hasn't begun yet. We've seen a small number of cases in Essex. But there will be far, far more, unfortunately. And this can be very, very serious disease, particularly in older people and people who've got pre-existing medical conditions, and they're the people we really need to look after.
Okay, so what should people do? I mean, I've seen people walking around with masks on. I saw somebody in a full NBC mask yesterday walking up the street. Does that help at all, or what should we be doing?
Okay, so no, it doesn't help. So in terms of what we should be doing, a number of things. First of all, most of the people trotting around in masks probably won't suffer very much from the condition, because in most people below 60, it's not very serious. A number of them will have it and not even know they've got it. Children tend to be particularly robust and not really suffer. So the most important thing to do is to be scrupulous about hygiene, so to wash hands as much as possible. That's because it does end up on surfaces. If you touch a surface and then you bring it to your mouth, you could give yourself the condition. So very frequent hand washing to keep your hands clean so that you don't give it to yourself, and also to keep your hands clean so you don't bring it to somebody who may be more susceptible to it. The second thing, which has only just come in from the government, is that anybody who's got a temperature, so it's kind of either or, a dry cough, and that's come on, a new cough which has come on, needs to isolate themselves, self-isolate for 7 days. That's because although there are still odd coughs and colds around for different reasons, more and more as the coronavirus gets common, if people have a temperature, it's most likely to, or a cough, it's most likely to be a coronavirus. Therefore, self-isolate yourself, and that's the best way of making sure it doesn't transfer to somebody else. So the third thing, which will be increasingly the most important, is what the government plans to do is develop this thing called herd immunity, which basically means that once a certain number of people in the community have got it, then it won't circulate anymore, because there's not enough people for it to jump to who haven't had it before. But in order for that to happen as safely as possible, those people who are at risk of having serious disease from it, so older people with pre-existing conditions, need to be out of that loop. So very, very important in the future will be that older people and people who are likely to succumb to the disease need to be isolated. They need to social distance themselves from everybody else, which here is called social distancing. So that's really about minimising contact with others, absolutely making sure that they don't contact anybody who knows they've got a temperature or a cough or anything. And that will be the best way in which we can protect those people.
So when you say don't come into contact, do you mean not be in the same room or not touch them? Or how far away do you have to be from other people?
So if we're talking about protecting older people, I think with discussion between the older people and their families, they may want to consider literally not visiting them for a few weeks, because actually that's the best way. If the people are literally isolated and they get their food brought in, it might drive them nuts, but actually that's probably the best way of preventing them from getting anywhere near the disease. If you do need to visit them, wash your hands before you go in. Absolutely make sure you haven't got a temperature or cough and can't be bringing the condition to them. And then if ideally sort of try and keep a couple of metres away.
So it's as bad as that, you know. Don't hug them or get in anywhere close to them. Okay,
you're not doing them any favours.
This is something that we will get through eventually, though, isn't it?
Well, and we'll get through at pace because what will happen is, as we're seeing in some other countries at the moment, there will be what's called an epidemic curve. That means a lot of people will start to get it very, very quickly. Once they've had it, the curve will go down again. So It's hard to say, but one would certainly think by August, September, the curve will have passed. I mean, we are trying to, in this country, to push it back and back and back. So maybe, beginning of September, if all the delay measures work well. But by then, this thing should be much, much less common. I suspect it will still pop up occasionally, but we won't see another epidemic curve again. But so I think this will be over by summer, late summer.
How much is known about it? I mean, it's very new. I've heard people say that the actual virus itself, when you look at it, get right down to what it's made of, it is similar in shape to a flu virus, but it's not a flu virus. Is research carrying on this all the time?
A huge amount of research, and so lots of different. So that both the research you're talking about, which is right at that sort of electron microscope kind of level, and also the epidemiological research to understand how it behaves in populations, because actually that's key to the prevention at the moment. It's a group of viruses that are well known. So actually, some of our colds that we get every winter are called by coronaviruses. It's also been responsible for two quite serious diseases, that were very serious diseases in recent years, which weren't as infectious, though, fortunately. So we know about the group of viruses. We don't know particularly about this one, and we are literally learning all the time.
I don't know whether this is a fair question or not, but I've read lots of things about it, and there's talk of a mortality rate of between 1% and 6%. Is that a reality?
Okay, so the mortality rate depends very much on how frail you are and how unwell you are, and also on how we count it. So the government is saying at the moment, they're saying it's a 1% mortality rate over the whole population. The problem is we actually don't know how many people have got it. So they're saying a 1% mortality rate, then they're saying, well, probably 5,000 to 10,000 people have got it. So actually the mortality rate might be lower than that, because there's a lot of people who have very, very mild disease, and they wouldn't be counted because we wouldn't know they got them. And also, the problem about the mortality rate is people, with the curve going up as it is quite steeply, what you find is that on a particular day, there's a certain number of people who got it. But a week or so before, when the people were infected, who then unfortunately get ill and die, there were lesser numbers. So it is quite a difficult figure to calculate. It isn't that simple. I think if we go with the 1% figure that people are talking about at the moment, that's probably not unreasonable. My personal guess is it's probably less than that.
Okay, so is enough known about it yet to know whether things like weather or how warm your house is or that sort of thing, is it known whether that has any effect yet?
So no, it's not known, but actually we do know that a lot of viruses do exhibit what's called seasonality, so that they're better or worse at different times of the year. And I think one of the hopes of pushing it back into the summer is that this one is one that prefers the colder weather, and therefore we may have a less severe peak in the summer. But there isn't any, that's conjecture, there isn't any clear evidence around that at the moment. What we do know is by pushing it back, there's less likely to be other coughs and colds around. So if you have the symptoms, it's pretty sure that will be what you've got, so you'll know to isolate and all this. And also taking the NHS away from winter pressures, first of all, it allows us to not have other ill people at the same time as the coronavirus, and also allows us more time to get the NHS even more ready by putting in even more sort of intensive care facility.
Okay, so just to recap quickly, wash your hands a lot, make sure that you keep clean, don't touch other people, and if you know people who are vulnerable due to existing conditions or their age, then look after them. Make sure they've got food and everything like that. But if you suspect in any way that you have it or you've been in contact with it, then stay away from them.
That's right, and that's absolutely spot on. You've absolutely captured it really well. I think increasingly there will be an ask of people to try and help out their neighbours. If they're older people and they can't go out, it's not wise for them to go out, get shopping for them, try and get some shopping in for them, so that they don't have to sort of walk around Sainsbury's with everybody else or wherever it is, they can really sort of keep themselves very much themselves as much as possible.
Well, thank you very much indeed for speaking to me today.
You're very welcome.
Serious advice. We have to make sure that, personally, I'm obviously going to follow it, and I hope that everybody else will as well. But Dr. Mike Gogarty, thank you very much indeed for being with me this morning.
Thank you very much.